Hi, my name is Kristen Stewart, and today I want to talk to you about something that happened to me in February 2016. I was sent to Highlands Medical Center for an emergency procedure done on my sinus canals in order to clean them out. I was having problems with multiple sinus infections and being sick all the time, and I was out of work and out of school. So they had planned to clean out my sinus canals in my cheeks, in between my eyes, and in my forehead that all had infection clogged in them. And they were also going to put a balloon structure in my nose in order for it to open it up. That way they wouldn't get clogged anymore. This procedure was supposed to be a 30-minute procedure. And after 2 hours of my mother and my husband being in the waiting room and not hearing anything back from the doctor, they started to get worried. Come to find out, I was on a ventilator and paralyzed for 7.5 hours. All because of an enzyme deficiency that I had no idea that I had. Pseudocholinesterase deficiency is an enzyme deficiency that is inherited. It can be inherited from your family, like your mother. She may not know that she has it, or it could be inherited from your grandparents that they never knew that they had it. The drugs that put you to sleep, the anesthetic drugs, are the ones that you really have to watch out about. Those drugs can cause many different problems. Succinylcholine and mivacurium are two of the main drugs that can send you into paralysis or respiratory failure. Like I said before, these drugs are used to put you under for anesthesia for medical procedures or even medical tests. Sometimes they'll put you under. This enzyme is a glycoprotein enzyme, and it's produced by the liver. It circulates in the plasma and hydrolyzes exogenous choline esters in your liver. And they still haven't found out what the physiological function is for this enzyme, but it's just there. Next, I'm going to talk to you about the different complications that arise from this deficiency. The main complications are caused by anesthetic drugs. That's usually where they see patients that actually have the deficiency. The possibility of respiratory failure, the possibility of cardiac death if you use cocaine, which I do not, but it's still there. Individuals with the deficiency can have neurological muscular paralysis, and I had respiratory failure and paralysis. Even though I could feel what was going on and I could hear what was going on, I was not able to breathe on my own, and I was not able to let the doctor or nurses know that I was awake. So I had heard everything in the room that was going on, including one of my nurses talking about which prom dress she wanted to get for her daughter. They ventilated me in order for the machine to breathe for me because my whole body just shut down. It didn't know what to do. It was completely asleep. I'm going to talk to you about how we handle something so intense and how they handle something so intense when they have a patient. There's not a cure for the deficiency. There's not a drug that you can take. I wear a medical bracelet. I don't have it with me right now, but I wear a medical bracelet usually. And that way, if I was to have a car wreck or something where I couldn't tell them that I had this, then they would be able to identify that they should not use anesthetic drugs that I could be paralyzed from. They can test your blood to make sure that that's exactly what's going on as far as the deficiency goes. You avoid all of the drugs listed, and there's some more drugs that I'll name off to you besides the ones that I've already mentioned. Any drug containing the choline esters, usually they'll have a word in front of it, and then the last part of it will be choline. So any kind of choline drug that is out there, you should not take it if you have this deficiency. Huperzine A and Novocaine, they usually use it for your teeth if you're getting dental work done. And Also, I had to notify my family and let them know that they needed to be tested for this gene also. Like I said before, your mother could have it and not even know because she's never had surgery done. Or she may have had surgery done and they didn't use the same drugs that they use on me to put you to sleep. Who can have this disorder? Or what is it caused by? 1 in 3,000 people in America have this disorder, and some may never know that they do have it. It's most common in European descent, and it's really rare in the Asian descent. Most individuals, like my husband and my mother, they handle anesthetic drugs just like normal people do. Everyone handles things differently, but most people, they'll gain their skeletal muscle function back in 5 minutes. Within the pseudocholinesterase deficiency, most people don't gain their skeletal muscle function back for up to 8 hours. It can be very deadly. Your body, if they don't catch it in time, your body may not be able to snap back from it. Elderly people, they may not know that they have it, and their bodies are just not strong enough to come back awake, is what they called it. And that's really terrifying for the people that have the enzyme and have no idea that they have it. Today I just explained a small introduction of the pseudocholinesterase deficiency and how it affected my life, and that there are so many diseases. I wanted y'all to know that there are so many diseases that people may never know that they have. And then you may go in for a medical procedure, or you may cut your knee, or, different things, just small things that you can do. And it may be life-threatening to you. It's just so crazy how there's so many deficiencies, diseases, disorders out there, and that we have no idea about. Now that you know about this and how it works, then you can be aware and educated. And you can also, if you're interested, look into different disorders, and deficiencies that are not very common as this one that I've listed before. Does anybody have any questions? Thank you.